Delta 9 molecule. If you know what Delta 9 THC is, you know what's coming next. I am a legal medical cannabis user, not only in California, where I have been for some time, but now I'm legal right here in Michigan, where I've been an outlaw for quite a while, people, because all these people downtown in the Capitol turned their backs on me for 30 years. I am now chairman of the board of the Michigan Medical Marijuana Association.
What do you have? What is this?
Oh, this is a nonprofit C3 corporation. We're basically the voice of the industry for now in Michigan, but eventually in the Midwest.
What's in that bag, though?
Oh, this is my medication.
Okay, that's your medication.
Yes, you see, I have really bad knees, joints, hips, arthritis. I have traumatic injury issues. I have 24/7 chronic pain of some degree. It's enough that I get to crawl up my stairs some nights, most nights, if I'm not medicated. And I do medicate legally because...
I smell something.
Do you? You shouldn't. It should be sealed pretty tight in there. That's generally a good idea.
Is it? That's one of the tips.
But here, this is the most important thing. If you're a medical cannabis patient in Michigan, what you really need is something like this. You can download these forms, this particular form, by the way, on our website. Just Google Michigan Medical Marijuana, and you'll fall right onto us. This is for my osteopathic surgeon, a gentleman at the MSU Sports Medicine Clinic, who I have always been totally open about regarding my cannabis use. From the very first time I met him, I told him what I was doing, and from the very first time, the only question he ever really asked me is, does it work? And of course it does. So he has certified me simply by stipulating here in this form that I have a severe osteoarthritis condition that causes me chronic pain, and the cannabis, in his opinion, having reviewed my medical record, will mitigate my pain, which is perfectly true. I have a reiteration of that in somewhat more depth inside.
Diagnosis.
And over here, just as sort of a souvenir value, I've got my California papers too. This is sort of like a double dipper because I live in 2 states, and I just put all my papers in the car, and I keep them in the car all the time. And I suggest that medical cannabis patients anywhere do that. Because when police stop you, you can establish very quickly your status. It's just like carrying a concealed weapon permit. If you have the permit, they're going to let you go. So I carry a pipe. I'm not going to take my medications out because I think I think under the law I'm not supposed to wave them around and display them. So
you
I'm
can
not
tell us
do that.
what they look like in there if you wish.
Well, here I can show you this. I carry some pre-rolled Michigan-grown, actually, very, very good, high-quality cigarettes in here.
Now, what's that called?
That's a little makeup case.
No, I meant what's in it.
Oh, what is the
that's
what
like
is the brand?
Case.
Yeah, this was. I'm not going to tell you.
Okay.
It's sort of a secret. We have a research team on this one. It's a beauty, though. You're going to see it in the future, believe me. You're going to see a couple Michigan varieties that are really, really interesting. Very, very effective. And one of the things we're trying to do, of course, is drive the price down. We don't want to have to compete with the illegal market. We want the illegal market to be overpriced.
I've got a question on that, Andrew. What do you think of the proposals to tax medical marijuana, much like is being discussed in California? What is
to tax sales, to tax transfers? I mean, really, we want to be like the hardware store.
Okay.
We're a legal business now. This is cannabis oil preparation. It's actually a really high-quality virgin olive oil that, for a few drops, will deliver about 100 milliliter dose of cannabinoids directly to my pain areas, and does some other things too. There's some other herbals in here. There's a lot of interest in this sort of thing in California. We're going to have to change the Michigan law to really allow us to develop this stuff here, but believe me, there are people here working on this sort of thing. I think it's natural for Michigan State University to get on this as an agricultural product. The county I live in California, just came off moratorium. They're estimating that they're going to make about $50 million, one county, per year on the sales and transfer taxes in Ventura County, California alone. So yeah, we're talking about a really big industry. It's a wonderful industry because it's locally produced. Anybody could do it. The money stays here. It stays right in your neighborhood because the law requires such small-scale distribution. Basically, neighborhood associations is what we're looking at forming around here. In fact, we're in Glenwire here tonight. We're going to be talking about that very thing.